Is it safe to take CoQ10 alongside Eliquis? Always speak with your GP or pharmacist first, and keep watching because there are a few important things you need to know. This video is for general information only and doesn't replace advice from your own clinician. If you're on Eliquis and thinking about adding CoQ10 to your routine, here's what the current evidence tells us. Eliquis, the brand name for apixaban, is a direct oral anticoagulant. It works by inhibiting factor Xa, which helps prevent blood clots from forming. It's commonly prescribed to reduce stroke risk in people with atrial fibrillation and to treat or prevent venous thromboembolism. CoQ10 or coenzyme Q10 is a naturally occurring antioxidant that many people take for cardiovascular health, energy support, or to help with muscle symptoms sometimes associated with statins. So, can you take them together? Based on current information, there is no known clinically significant interaction between CoQ10 and Eliquis. CoQ10 is not listed as a contraindication in the Eliquis summary of product characteristics, and it doesn't appear to significantly affect the metabolic pathways that apixaban relies on, specifically CYP3A4 and P-glycoprotein at typical supplement doses. That said, it's important to be honest about the limits of what we know. Clinical evidence specifically looking at this combination is limited. There are no published case reports of adverse interactions, but that doesn't mean the combination has been extensively studied in clinical trials. So while the picture looks reassuring, it isn't complete. This is quite different from warfarin, the older anticoagulant, which has a long list of documented interactions with supplements and foods. Eliquis generally has a more predictable profile in that regard, but being on any anticoagulant still requires care and consistency. One supplement you should absolutely avoid with Eliquis is St. John's wort. Unlike CoQ10, St. John's wort is not recommended alongside apixaban because it can significantly reduce apixaban levels in the body, potentially making your medication less effective and increasing your risk of clotting. If you're considering taking CoQ10 alongside Eliquis, the most important step is to speak to your GP or pharmacist before you start. Let them know everything you're currently taking, including supplements, vitamins, and herbal products. If you do take CoQ10 with your doctor's knowledge, try to keep your supplement routine consistent and always take your Eliquis exactly as prescribed. On the safety side, anyone taking Eliquis should know the signs of unusual or serious bleeding. Things like bleeding that won't stop, blood in your urine or stools, coughing or vomiting blood, or unusual bruising. For severe or uncontrolled bleeding, a head injury, or suspected internal bleeding, call 999 or go to A&E immediately. For anything less urgent, contact your GP or pharmacist promptly. You can also report any suspected supplement or medication interaction through the MHRA Yellow Card scheme. That's the UK's system for flagging suspected side effects, and it genuinely helps build the evidence base for everyone. So, to recap, there is currently no known clinically significant interaction between CoQ10 and Eliquis, but the evidence is limited. St. John's wort should be avoided with apixaban. And whatever supplements you're considering, always speak to your GP or pharmacist first, especially when you're on an anticoagulant. This video is for general information only and is not a substitute for personalised medical advice. If this was helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, give this video a like and subscribe to the Bolt Pharmacy channel for more straightforward health information.